What's up, fam? This is Dr. Jali welcoming you to episode 4 of Thriving Throughout. So today we're talking about trauma in the family. It's a family affair. Let's revisit some definitions. Today we're revisiting trauma bonds, which are relationships formed by shared traumatic experiences, trauma cycles, which are behavior patterns that are established by an initial response to trauma, and post-traumatic stress disorder, which is a mental health condition that is triggered by exposure to a traumatic event. At the end of the Civil War, about 4 million people were released from slavery. That's 4 million people who have and whose ancestors had endured about 350 years of chronic exposure to traumatic events. None of those people received mental health services, therapy, even physical health support, financial support. Many of them couldn't read, they weren't educated, they weren't able to communicate their needs and their wants effectively because for their entire lives, they had been in bondage. Fast forward another 150 years, there is still a significant stigma on Black people getting mental health supports and services. So what does that mean? Where did all of that trauma go? It just got passed down from generation to generation. Trauma can be inherited physiologically, biologically, socially, and psychologically. We are actually born with the physical imprints of our parents' experiences. We're born with their physical imprint, they're born with their parents' physical imprint, and so on and so forth. That means when we look at our genetics and our DNA, we are carrying the experiences of all who have come before us. Children of parents with PTSD or post-traumatic stress disorder are more likely to exhibit symptoms of chronic depression, anxiety, and stress. It stands to reason that most or all of those who were released from slavery had some form of undiagnosed PTSD. However they responded to their trauma became a part of their normal functioning, which became ingratiated into their family structures. We've said it several times now, trauma is cyclical. If there's nowhere for that trauma to go, then it just gets passed down. We all inherit positive and negative traits from our family members. The question to ask is, what would you like to keep moving forward, and what should be left in the past? Look at some of the communication patterns in your own family. Do you find that it's hard for people to apologize, to say what they really feel or what they really mean without an argument or a blow up? Do you find that you guys maybe repeat the same patterns over and over again even though you know it hurts? When people are traumatized and don't get the help that they need, most of them end up sacrificing important relationships. When a person is traumatized, their initial response is to shut down any threat of harm. They may build walls, struggle with speaking their mind or speaking their feelings clearly, and they may act out of their trauma. In many cases, that translates to emotional abandonment and rejection. Many people have talked about their families not saying the words, "I love you," or not being able to demonstrate that more than giving them things or buying them things. People have experienced physical abandonment where a parent walked out on them or a family member maybe cut themselves off from the family. In many cases, we are acting out of our collective trauma. We might not even know where it came from or where it started, but it's become the norm and it's become part of our legacy. It's true. We've survived as a culture and as a race by sticking together. That's why we're here in so many ways. We have stuck together. We've looked out for one another. We've warned each other when we saw trouble coming. And what happened was we became trauma bonded. And when you're trauma bonded, those relationships are built on pain. We survived by sticking together, but we've also broken each other down by not healing and developing healthier bonds. How many conflicts in your life and in your family could have been resolved if you just took the time to say, you know what, let's talk this through? And we've been conditioned not to talk about it. Most of us have behaviors that even if we cognitively know better, we have been conditioned, and you have to recondition yourself to break those habits. A lot of behaviors are based on lack of skill, understanding, and education. When we know better, we do better, and we should be teaching better. My personal philosophy in life is to teach the teachable. For as many people who seem to reject you, there are so many people who are looking to learn and do more. Normalize reconciliation. Normalize individual and relational healing. Recognize that everybody is experiencing life in their own way. Not that you have to tolerate being hurt or abused, but it is possible to teach and model what we want to see. We want our families to thrive, because when families thrive, the community thrives, the children thrive, and we all move forward together. We're imprinting new things into our DNA because we're no longer here just to survive, but to thrive. Next week on Thriving Throughout, Trauma and Religion. Don't forget to like, subscribe, and follow.